Well, thank you very much. Let me begin by first paying tribute to Steve Ladakos, who was a professor of biostatistics at Harvard University, who passed away tragically in an automobile accident last month. Steve was a real giant in our field of biostatistics and in public health. He made enormous contributions to survival analysis, to clinical trials, and in HIV methodology, HIV epidemiology. I had the great pleasure to serve with Steve. He chaired an Institute of Medicine panel recently on HIV methodological issues, and he was really a wonderful colleague, very insightful statistician. He really has been a role model for me my entire professional life, so it is a really great loss, I think, to the field. In fact, he was a Spiegelman winner as well. He won the Spiegelman Award in 1983. I'd like to extend my congratulations to RAPA and to all of the section award winners. I'd also like to extend my thanks to the statistics section for the invitation to speak today. It is an honor to have the Lowell Reed lectureship and to really be a part of the statistical community at APHA. So thank you. What I'd like to discuss today is measuring the HIV/AIDS epidemic approaches and challenges. And my goal is to discuss some of the methodologies that are being used to produce national and global statistics on the HIV epidemic. What are their issues, what are their problems, and what are the future challenges for obtaining improved statistics? And the statistics are changing. The latest UNAIDS worldwide estimates said that HIV prevalence, the number of people living with HIV infection, decreased from their previous estimate by 6 million people. UNAIDS also said in their latest set of statistics that HIV incidence, which is the number of new people who became infected annually, that also decreased from their previous estimate by 42%. Now, these changes of the statistics are not without some controversy. So, New York Times. UN agency denies inflating cases of HIV deliberately. After releasing new figures showing that the global AIDS epidemic is smaller than it previously reported, the United Nations AIDS Fighting Agency denied yesterday that it had inflated estimates for years in an alarmist effort to raise funds. Indeed, James Chin, who is the former director of HIV surveillance at UNAIDS, wrote in his book, The AIDS Pandemic, The Collision of Epidemiology with Political Correctness, from the beginning of the HIV/AIDS pandemic, there has been a general tendency to overestimate HIV prevalence for many populations. In some situations, overestimates rather than underestimates have been deliberately chosen for advocacy purposes. Now, this issue about overestimation, there's also been claims of possible underestimation. In an editorial, the editors of The Lancet, writing about anticipating the latest CDC estimates on HIV incidence, which looked like they were going to be higher than they previously had said. The editors were writing about the delay in releasing these new statistics, which would actually show increases in HIV. The editors said, AIDS campaigners have been calling on CDC to release the latest HIV incidence data, which has been reported to be closer to 52,000 than the previous estimate of 40,000. The figure shows that U.S. efforts to prevent HIV have failed dismally. The CDC must not fail U.S. citizens further by delaying release of the data. And indeed, when CDC did release their most recent estimates of HIV incidence, it showed a 40% increase from what they had previously been citing as the annual number of new infections. Now, UNAIDS actually, when they examined the U.S. data, they actually said that there was no change in U.S. HIV incidence from their previous estimates. So all of this is a bit confusing. Why are the statistics changing? And what are they based on? And how reliable are these national and global statistics of the HIV epidemic? So to begin, first some vocabulary. HIV prevalence refers to the proportion of people who are living with HIV infection. HIV incidence rates is the risk or hazard or probability of getting infected in the past year. So incidence refers to new infection, whereas prevalence can be long-standing infection. So let's begin with HIV prevalence. Why are the HIV prevalence figures changing? So Science magazine. India slashes estimate of HIV-infected people. Improved and widened surveys of the country's massive population has led India's National AIDS Control Organization, NACO, to slash by more than half the estimated number of people infected from 5.7 to 2.5 million. In the past, India's HIV estimates have relied heavily on a limited number of sentinel surveillance sites, like clinics for pregnant women. The new analyses include data from voluntary blood samples taken from more than 100,000 people in a national household survey. So previously, India, as many countries were relying on specialized surveys of pregnant women who were attending antenatal clinics. Now they had a new national household seroprevalence survey, and that was now being the basis for the prevalence estimate. And indeed, since the year 2000, over 30 countries now have performed national surveys of HIV prevalence, household probability-based surveys. And the estimates, these are primarily fall under the family of studies called the demographic and health surveys. And the ranges of the HIV prevalence rates that we're seeing out of these household surveys range from as high as 26% in Swaziland to 0.28% in India. Now, we now have an opportunity to go back, since we now have these surveys, national household surveys, to see how concordant they were with the antenatal clinics surveys, which was what the main approach that we had been relying on in many countries. So in those countries where we now have both HIV prevalence surveys from national household surveys and the antenatal clinic studies, this is an analysis by Gauss which shows the ratio of those of the survey result versus the antenatal clinic. And you're seeing it here in various countries. And the black bar is in urban areas, and the white bar is in rural areas. And if those numbers, those bars are under 1, it means the survey, the national surveys, are coming up with rates lower than the antenatal clinic data. And generally, in red there is the median ratio, and the median was about